According to the report presented to the Parliamentary Forum on Mental Health, a staggering 14 million Ugandans are currently afflicted by mental disorders, constituting 22.9% of children and 24.2% of adults. In a move to have statistics reduced, today Church of Uganda provincial secretariat officials have had an engagement with You Belong Uganda, a civil society that creates awareness about mental health issues as well as care for people affected by mental health, with the motive of spreading information of other signs of mental illness in the communities, identification of patients for better referral to health facilities.
A team from You Belong Uganda came to offer us some services in terms of speaking to us about mental health. Mental health is one of the challenging situations, or I call it disease also, because it affects the health of a person. And this is challenging so much in Uganda at the moment.
Provincial Secretary, Church of Uganda, Reverend Canon Captain William Ongeng, says that mental health is one of the challenges in the country. Therefore, Church of Uganda partnering with civil society fraternity is very crucial.
This team is coming to partner with us so that we can incorporate this in the gospel. Whenever a minister is on pulpit, make sure that you speak a little about mental health. And we are made to understand that mental health is something that can be rated on a scale. All of us are mentally disturbed or sick in a way, but the degree varies. So that degree is what we want to control.
Reverend Ongeng added that Namirembe Diocese and Kampala Diocese are to work as pilot study in the awareness campaign, and it will later be extended to other dioceses in the province.
At the moment, the dioceses of Namirembe and Kampala, which constitute the greater Kampala metropolitan area, are going to be piloted, and this pilot will show us what it looks like when they are testing on the ground. How do we access and how do we support? And later this will be extended to the 39 dioceses of the Church of Uganda.
He pointed out that when dealing with the issue of mental illness, the key focus should be on relationships, as a significant number of these illnesses stem from poor relationships within diverse communities.
One of the things that we need to address is relationships. Quite a number of mental cases are coming up because of poor relationship, either from within homes or the community or even the peer groups. So those relationships can affect the mind of a person.
Edith Kebirungi, senior worker under You Belong Uganda, says that partnering with Church of Uganda will allow them to create awareness about mental health and provide care for people affected with mental illness.
So we are partnering with the Church of Uganda to be able to create awareness about mental health and provide care for the people who are affected by mental health problems.
In addition, she highlights the objective of raising awareness about the initial symptoms of mental illness, empowering communities to identify individuals experiencing these signs and guide them towards necessary treatment.
We are partnering with religious organizations, particularly Church of Uganda today, to be able to spread information about signs and symptoms of mental illness, and so that people can be able to identify and refer people to health facilities.
Additionally, Kebirungi emphasizes the prevalence of mental illnesses among community members, who is considerable number of individuals still lacking access to necessary treatment. Consequently, this poses a pressing challenge that necessitates immediate attention.
People are there in our communities struggling with mental health problems, but they have not had the opportunity to get treatment. And this is what we are trying to strengthen in our communities.
Some of the root causes of mental illnesses are issues like poverty, lack of employment, among others.
Majorly, there are environmental factors that are unique to everyone. So the environmental factors like poverty, social problems, stresses of daily life. It's stresses of daily life that
Kebirungi advised the public that in the case of any sign of mental illness, they need to seek for treatment and live a functional life. She revealed how some people can notice that they have a mental illness in order to seek for treatment. Furthermore, she called upon communities to eradicate the stigmatization associated with mental illness.
Maybe to also make us aware that you cannot only follow one symptom, that this person has been lacking sleep, so they have mental health problems. It's a combination of symptoms. But that's some of the things that you can look out for once you realize that you are having no sleep, you're hearing voices that other people cannot hear, you're seeing things that other people cannot see, you have sleep disturbances, you have eating disturbances, you have extreme sadness, aggression and violence in our communities. So once you notice that you have these early symptoms, please go to your health facility and inquire if these are signs of mental illness.
Julius Mamuza, Church of Uganda Family TV, News at 8.